Spinal cord is the main highway of your nervous system. Once badly damaged, it may never fully heal, but many spinal cord and serious spine problems start with everyday mistakes we can prevent. Spinal cord carries signals between brain and body, and serious injury can cause paralysis, loss of sensation, bladder, bowel problems, and chronic pain. What is a spinal cord problem? Spinal cord problems include traumatic injuries from accidents, falls, sports, violence, and non-traumatic issues, degeneration, disc problems, chronic poor posture, and repetitive strain, severe back or neck pain after injury, weakness, numbness, loss of bladder, bowel control, or trouble walking. These need emergency or urgent care. Dangerous habits and situations you must avoid: unsafe driving and using proper child restraints, never driving under alcohol, drugs, avoiding speeding and mobile phone distraction, risky falls at home and work falls, especially in older adults and workers at height, cause many spinal injuries. Clutter-free using non-slip mats, handrails, proper lighting, and following safety rules on ladders, scaffolds, and stairs. Diving into shallow or unknown water. Diving accidents in pools, rivers, or the sea can cause neck fractures and permanent paralysis. Dive into shallow or murky water. Always check depth and follow feet-first rules in unfamiliar places. High-impact sports and reckless moves like tackling head first or spearing increase neck and back injury risk. Helmets and protective gear. Learning safe techniques, having trained supervision, and avoiding playing through serious neck, back pain. Poor lifting technique and heavy loads. Lifting heavy objects with a bent back or twisting can damage discs and vertebrae, leading to nerve compression and chronic spine problems. Keep loads close, bend at the knees. Keep the back straight, lift with the legs, use trolleys or help, and avoid excessive weights. Chronic poor posture and tech neck. Long hours of slouching at desks or looking down at phones strain the spine, weakening muscles and speeding wear and tear. Ergonomic setups, screens at eye level, feet flat on the floor, head aligned with shoulders, and breaks every 30 to 60 minutes to move and stretch. Smoking, obesity, and inactivity. Smoking reduces blood flow to spinal tissues, and excess weight adds mechanical stress, worsening back pain and degeneration. Quitting smoking, maintaining a healthy weight, and regular low-impact exercise such as walking, swimming, or yoga to protect spine structures. Ignoring early pain, numbness, or weakness. Delaying evaluation when there is persistent back, neck pain, radiating leg or arm pain, tingling, or weakness can allow treatable problems to progress. Medical advice early and follow rehabilitation or physiotherapy plans to prevent worsening or permanent nerve damage. If this video gave you clarity or hope, please like this video, share it with someone who needs to protect their spine, and subscribe to Medickpidia for more science-based, heartwarming health content. Together, let's turn awareness into protection and protection into hope for every patient and every family.